Aspercreme lidocaine is used to help reduce itching and pain from certain skin conditions such as scrapes, minor skin irritations, insect bites. It may also be used to help relieve nerve pain after shingles, infection with herpes zoster virus. Lidocaine belongs to a class of drugs known as local anesthetics, which works by causing a temporary loss of feeling in the area. How to use. Adults and children over 12 years. Apply thin layer to affected area every 6 to 8 hours, not to exceed 3 applications in a 24-hour period. Children 12 years or younger, ask a doctor. Contraindications. Methemoglobinemia, a type of blood disorder. A type of slot heart rhythm disorder called heart block. Decreased lung function, liver problems. Seizures, a condition where the body is unable to maintain adequate blood flow called shock. Large open wound. Anemia from pyruvate kinase. Sepsis. Warnings. For external use only. Do not use on large areas on the body or on cut, irritated or swollen skin. On puncture wounds, for more than 1 week without consulting a doctor. When using this product, use only as directed. Do not allow contact with the eyes and mucous membranes. Do not bandage tightly or apply local heat, such as heating pads or a medicated patch to the area of use. Do not use at the same time as other topical analgesics. Stop use and ask a doctor if conditions worsens, redness is present, irritation develops, symptoms persist for more than 7 days or clear up and occur again within a few days. Pregnancy, breastfeeding warning. If pregnant or breastfeeding, ask a healthcare professional before use. Side effects. Redness, swelling, blisters, or changes in the skin color at the site of application may occur. These effects usually disappear within a few minutes or hours. If any of these effects last or get worse, tell a doctor or pharmacist promptly. If irritation or a burning feeling occurs, remove the patches and do not reapply until the irritation is gone. Tell a doctor right away if you have any serious side effects, including blurred vision, mental mood changes such as nervousness, confusion, drowsiness, dizziness, unusually slow heartbeat. A very serious allergic reaction to this drug is rare, however get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, especially of the face, tongue, throat, severe dizziness, trouble breathing.